Hi, this is Dr. Devin Spinal Care of Nevada, and Carson with 10 tips to improve your immune system. In today's day and age, there's two strategies. One is all the recommendations from the CDC, which work just as well in a doctor's office as they do in your house. We are disinfecting, cleaning, sanitizing all surfaces, washing our hands for 20 seconds before and after patients, spreading our patient visits out, just like you should be doing social distancing. That wasn't a good idea? The other thing that we're doing is cranking open our front door, just like you should be opening your windows. Let the circulation go through. Now, if you've ever been to one of my lectures, you know I'm going to give you far more than 10 tips, so let's get into it. You ready to go to the classroom? So what is the immune system? Think of it like the armed forces of your body. You've got the Navy, you've got the Air Force, and the Army, all defending your health against the foreign invaders. Up comes the foreign invaders, and all the soldiers, or T cells or CD4 cells, also known as white blood cells, start to proliferate or separate, basically divide and conquer. Now the problem is that works really well when you're younger, but as we age, that process gets tired. A structure called the neutrophil, which is also critical for the immune system, starts to get uncoordinated. Think of the reaction time as getting worse. It stumbles. Now, the University College of London is studying ways to actually reverse that immune system process. But in the meantime, you know what they recommend? Natural solutions like improving your diet. I actually assisted in a research study 20 years ago back at Life Chiropractic University on ways to improve the immune system. We took patients who were severely immunocompromised. They had HIV. We treated them, and over the course of 6 months, found that their CD4 cell count, which again, the white blood cells, increased by 48%. That's tremendous. The sad story is we had to have a placebo group. The patients that weren't treated, their count went down by nearly 6%. So all the tips we're going to give you are absolutely critical to having the strongest body and helping you fight off infection. Welcome to Immunity University. By profession, I'm a NUCA chiropractor. In other words, a natural health care provider, and I've got a couple wellness-based clinics. What I'm not licensed to do, and by profession I don't do, is treat virus, bacteria. Thank goodness we have doctors in hospitals and caring nurses to help with that. My role, after we help patients get out of pain, is to teach them strategies so that they can continue to stay healthy. Now, this is a lecture that I've had the pleasure of doing over the past 20 years. I've been to hospitals, I've been to community groups, I've been to local businesses. We're going to follow the acronym DREAM. D is for diet, R is for rest and sleep, E is for exercise and stretching, A is for proper alignment, and M is for positive mental attitude, which is also important in a healthy immune system. Let's get started. Now, I'm not going to pretend that I can give you all the advice on a healthy immune system in a really short video, so you could and probably should be going online and doing searches on your own for how to build a healthy immune system. Let's begin with diet, which is supplementation, the fuel we're putting in our body. I tend to agree with Harvard Medical School saying that fruits and vegetables are a critical staple of building a healthy immune system. Now, we teach our patients, try not to cook them when you can, because that kills the enzymatic activity, kills a lot of the nutrients. Vitamin D, we recommend about 1,000 milligrams a day. Now, you can get that supplemental, but remember this, I know a lot of us are staying in our houses, but if you can get out into the driveway, into the backyard, into a safe area, get 20 minutes of sunlight a day. Studies show that decreased amounts of vitamin D have a negative effect on the respiratory system. Vitamin C, 1 to 2 grams a day. Zinc, 200 milligrams a day. Now, with zinc, that needs to be taken just prior to the onset of a cold occurring. So you feel the symptoms, you get the zinc down. Echinacea, lots of ways to take that, 2,400 milligrams a day. Echinacea has also been found to do best when you're taking it over time. Garlic, lots of ways to have the garlic, lots of repercussions of garlic, so talk to your spouse about it first. But the healthiest thing in garlic is called alanine. So there are people, believe it or not, that actually chew the garlic to get the alanine out. You can also cook with it and take it from a supplemental version. Probiotics. Probiotics are critical to the immune system. Lots of ways to get those. You can take them through supplements, but remember this too, you can also get them through some food sources. Let's see, things like sauerkraut, miso, and healthy yogurt, not the ones with tons of sugar in them. Okay, green tea. I drink green tea all throughout the day, lots of antioxidants, and of course, we're trying to reduce the amount of sugar, white sugar. Where is sugar hiding? Just about everywhere. White bread, white pasta. So we try to go for whole wheat, and if you are gluten intolerant, you go for the gluten-free version. Do you remember the old food pyramid? And do you remember the main thing they used to tell you to eat was the breads and the pastas and the wheats? There's a new food pyramid. And on the very bottom, the base, the main thing that we should be having, you got it, veggies. Up from there, organic proteins, meats, healthy fats, avocados, nuts, oils. There's a little bit of fruit on top. Fruit aren't bad. People think, well, I'm going on a diet, I gotta lay off the fruit. There's tons of sugar in them. Yes, if you're diabetic, they take you off bananas right away, but you've got to get the fruit in there as well. Proper rest and sleep. According to the UCSF, the ideal number of sleep hours in a night is 6. Now, I certainly try to get more than that, even if it has to get broken up. Here's some tips on getting better sleep. Be aware of your lighting. At night, studies show that amber bulbs, amber lighting, and low lighting up to an hour before bedtime help you drift off easier. Bright lights, LED lights from your cell phone, yes, from that midnight snack, can keep you up longer. Drinking. Listen, studies do show drinking wine in moderation have helped some of the longest lived societies get to 100 and beyond, but know this, that's moderate level drinking. Alcohol can help get you to sleep, but it doesn't help stay asleep. It tends to screw up what's called the circadian rhythm. Remember, there are side effects to sleep medication. I'm not saying that drugs are, prescription meds are bad. I'm just saying you have to be aware that there's other side effects, including things such as sleepwalking, sleep eating, even sleep driving. Here's a tip. For those of you who can get to sleep, but then like me, you wake up in the middle of the night and your mind starts going and spinning, it's actually a good idea to get up out of bed. Sit somewhere quiet, maybe make a cup of tea, read a chapter in a book, again, low lighting, for maybe a half hour, 45 minutes, change your environment, and then go back to bed. Helps you get back to bed a lot easier. Okay, sleep position. Here's what's important, is how am I going to set up my bed to support the structure of my body to get a good night's sleep? Now, the healthiest position is on your back. Pillows under the legs, prop yourself up a little bit. Those with breathing issues, yes, you have to prop yourself up more. Side sleeping is okay, but you tend to twist more. If you're going to sleep on your side, pillow in between your knees, hug a pillow, and if the bed is here, my pillow is thick enough so my head's not cranked one way or another. Stomach sleeping is obviously the worst because your spine is cranked to one side or the other, which can pinch nerves. And remember your posture. Those with snoring, sleep apnea, sometimes that can come from bad posture, what's called the dowager's hump. That's the big old hump in the back of the neck, shoulders roll forward. Yes, I see patients all the time and we help them with this condition, but that can decrease your lung capacity up to 30%. So posture is another important one for getting better sleep, and better sleep is so important for a healthy immune system. Okay, exercise. Yes, probably doesn't surprise you that Harvard Medical School also recommends exercise to help the immune system. According to medlineplus.gov, exercise, moderate exercise, can help flush bacteria out of the lungs and airways, which can help reduce colds and illness. What exercise also does is it helps in a positive way change the antibodies and CD4 cells, which we talked about earlier, are the white blood cells in your body. Studies also show that very, very intense exercise, up to 90 minutes and more done at an intensive level, will actually decrease the immune system for a short period of time. Now, how am I going to do that? Doc, I'm all cooped up in my house. You can get out and get a walk. When I walk the dog, when someone's coming, I just check both ways and mosey out and towards the middle of the street, and I keep my social distance. So you get out, get walking. If you have some steps in your house, you can gently go up and down the steps. You can order light weights, light bands. Again, do some research on your own. Go into YouTube and you can do a Google search for at-home exercise compared to your age. At-home exercise for 40 and over, 50 and over, 60 and over. Keep it safe, keep it moderate, but most importantly, keep it moving. Up next, proper alignment and posture. Now, what does that have to do with an immune system? Do you remember that study I mentioned where we increased patients' CD4 cell count 48%? That was done with chiropractic adjustments to the top of the neck. But there's things you can do to improve your posture and alignment. So, when you're sitting at home in the chair, what I want you to do is bend forward, scoot back, get your butt all the way back. Now you can feel the back of the chair and lean back. When you are forward of the chair, we tend to slouch. That rolls the shoulders forward. That increases the dowager's hump. Scoot, lean. You can also put a pillow behind you when you're sitting at home to help support your low back. If your feet don't hit the floor, guess what? That pillow behind you will help, and a pillow underneath your feet. When we actually get back into driving again, do the same thing in your car. Adjust the rearview mirror. That way, if you can't quite see out of the back, you know you need to sit up better. Posture and alignment are very, very important to not just a healthy body, but a healthy immune system as well. Positive mental attitude. Mental and emotional, that side of the immune system in your health cannot be overlooked. According to a study out of the University of Queensland, having a positive mental attitude has a strong effect on, guess what? The immune system. Hey, I've got a test to see whether or not you have a positive mental attitude. If you just won megabucks, imagine that for a minute, and the first words out of your mouth are, well, gosh, you got to pay half of that in taxes. You may not be looking at the bright side of life. Okay, another study out of the Journal of Psychology and Aging found that older patients who focused on positive information coming in lived longer. So yes, it's good for us to be informed, but guys, you got to turn off the news channel from time to time. And guess what? Turn on a comedy. It's great to laugh. It's great to have fun. That has a strong effect on your health. And remember this, in this day and age of social distancing, it might actually be our greatest opportunity for social connection. You have the time during the day to go into your contacts list on your phone, or for those of you who still have a Rolodex, and dial up a couple people that you haven't talked with in a while. Touch base, connect. Maybe it's an old military buddy, or a friend from college, or maybe somebody you used to work with, or maybe it's somebody you need to make amends with. Either way, take some time every day to reach out and connect. We're all in this together. This is Dr. Devin, Spinal Care of Nevada, helping you have a strong immune system and a healthy life. Please share this with others. This information is critical to us all getting through this time in our lives and coming out the other side even better than we were before. Guys, have a phenomenal day.